school bus. Spank a plankton too.
Take that!
On our magic school bus. Stop the river of lava. On magic school bus. Such a fine thing to do. So strap your bones right to the seat. Come on in and don't be shy. Just to make your day complete. You might get baked into a pie on the magic school bus. Step inside, it's a wild ride. Come on, ride on the magic school bus.
Come in.
Hello.
Hey.
We heard you weren't feeling well.
No, I'm not feeling good at all.
Well, what's wrong?
Well, I'm really tired all the time. And whenever everybody goes out for like recess and stuff, I can't really do anything because I can't breathe very well. Like when I try to run around or something, I get really short of breath. And then my heart, like sometimes even when I'm not doing anything, my heart it pounds really hard and stuff, and so I'm just sitting and reading.
Well, reading is good for the mind, but I'll leave you to your studies, and I will come back and check on you later. I know your classmates are concerned about you.
Okay.
So we'll be
Tell
back.
Ma I said what's up.
I will.
Okay.
Well, students, she's having some heart problems and shortness of breath, so I've got a great idea. We're going on a field trip. Yay! So to the bus!
Yes!
All right, students, is everyone on board?
Yes!
Yep.
School bus, do your stuff!
All right.
We're off to the bloodstream!
Woohoo!
Here we go!
Wow, where are we?
We're in the bloodstream to observe how cardiac drugs affect the heart. So let's go!
All right.
Next, students, we're going to be learning about digoxin and how it enables the heart muscles to increase their contractility. So let's watch as digoxin gets in the bloodstream and helps the heart get moving.
I'm a digoxin.
Okay. Well, I see that the blood can't really go anywhere. The muscle isn't contracted enough.
Tighter! Tighter! Increase the contractility!
Oh, okay, now the blood can get moving. Yes, that's right. Okay, that makes sense. All right, now let's see what Nurse Rachel has to say about digoxin.
Cha-ching. This is so fun! So fun!
Hello,
Hey.
I'm your nurse, Nurse Rachel.
Hey.
How are you doing today, Miss Maddox?
I'm good.
Okay, well, one of the most important things that a nurse does is educate her patient. So I'm here now in this place to educate you. We're going to talk a little bit about this medication you're taking. Do you know what it's called? It's called digoxin. And there is a risk for something called digitalis toxicity, which means there's too much digoxin in your blood. Some common symptoms of digitalis toxicity are anorexia, which means you're not hungry.
No, I don't want to eat anything.
Diarrhea, it's an awkward one. Nausea and vomiting. Headache. Visual disturbances.
Is that a halo on your head?
Well, that can be a common visual disturbance. Also, double vision. So if you see two of me, I don't have a twin. And the last one is confusion and delirium.
Yeah, I am a little bit confused.
Okay. I need to make note of these symptoms that you have experienced. And we're probably going to have to do a blood draw to check to see if what her therapeutic range of digoxin in her blood is. Ideally, we want it between 0.5 and 2 nanograms per milliliter. And while you are on this digoxin medication, we want to make sure that you eat lots of potassium.
How do I do that?
Well, we're going to eat lots of green leafy vegetables and bananas and
I like bananas.
potatoes.
I like bananas with peanut butter too.
Well, we'll make sure we put that right down on your list of things you like to eat. All right? If young Miss Maddox were to have some more problems with digitalis toxicity, we might have to give her digoxin immune fab, which is an antidote. Lastly, I'm going to teach you how to check your heart rate to make sure it's in an appropriate level before taking your medication.
Before taking it?
Before taking your medication.
Always before.
Always before taking your medication.
Always.
You only need a couple of simple things. First, a watch. Orange preferably because that is God's favorite color. And second of all, some phalanges. Preferably not your thumbs because those are bad. No one really likes thumbs anyway. So, you're going to place your 2 fingers right here on what is known scientifically as the radial artery. And you're going to feel for the pulse for 60 seconds or 1 minute. I'm going to save us the time by already knowing that her pulse is above 60 beats per minute. And then we can administer the medication. Do you feel ready to do something like this on your own, Miss Maddox?
Yeah!
I'm so excited. Now that we've had this education session, do you know what medication you're currently taking?
Digoxin.
Great! Back to the school bus!
I want you to see how the red blood cells are pushing together against the vessel walls and increasing the pressure. We want to administer an antihypertensive so that they're able to flow through the vessel more freely. So let's watch as it does its job.
I'm the antihypertensive. Open sesame.
Oh, now it can flow through with less pressure. All right. Well, let's go to Nurse Rachel and see what she has to say about antihypertensives.
Hello, Miss Maddox.
Hey,
How are
Nurse
you
Rachel.
doing?
I kind of ran out of stuff to do, and so I'm pretending to be a motorcycle rider.
Oh, well, that's delightful.
Yeah.
I came in here to talk about your possible side effects of taking antihypertensives.
Really?
Would you like to talk about that?
Yeah, before I hit the road again.
Okay. The first one is orthostatic hypotension.
Is that all?
No, there's
Good.
more.
Oh.
Well, the problem with orthostatic hypotension, come on. Maybe it's time to, yeah.
Kind of weird. I feel
Yeah,
weird.
let's just stay in this position here. What happens is your blood pressure is real low when you first sit up or when you try to stand up too quick. So we want to do it slowly. It's a good thing you are wearing this helmet.
Yeah.
We can take it off now, I think. So that then
Yeah, but can you help me take it off? I don't feel good at all.
you just sit right there, all right?
Okay. Wait. Okay. Oh. Man.
Oh man,
Oh,
that
so
was an
good.
adventure. All right,
Wow.
that's okay. We'll talk about the rest of your symptoms right here in a comfortable place.
Okay.
The rest of them are sometimes you can get drowsy, feel a little dizzy, your heart rate can decrease, go a little bit slower. You can have a dry mouth, but don't worry. If you have a dry mouth, we're going to give you some sugar-free candy. The benefits of being in the hospital, right?
Yeah.
Also, there's headache, nasal congestion, and remember when we talked earlier about gastrointestinal upset.
Yeah, I didn't
when
like
you
that part.
have vomiting or nausea or diarrhea.
I hate that part about it.
Yeah. Well, let me help you up back into your chair.
Okay.
And promise you won't try to get up out of it anymore because we have had no good experiences with that,
No.
Miss Maddox.
No, we haven't. I just can't sit still anymore. Can't do it.
Yeah, well, what we could do are some ADL exercises with your feet to help you to feel better.
Oh, I didn't even think about that. That's better than my motorcycle idea.
All right. Well, class, let's go back to the body and back to Miss Frizzle so we can find out what else happens in the body with medications.
All right, students, today we're going to learn about antidysrhythmics. And when they enter the blood, they slow conduction and return the heart to a normal rhythm. So let's watch as the antidysrhythmic enters the bloodstream. Okay.
I'm the antidysrhythmic. Slow down. Another heart saved by the antidysrhythmic.
All right, now let's see what Nurse Rachel has to say.
I'm done with this. I'm getting up. Oh, I feel dizzy.
Oh my goodness, what are you doing?
What?
Patient, you must sit down.
Why?
Oh my goodness. While taking antidysrhythmics, one must always remember that one can experience fainting, dizziness, nausea, vomiting. Miss Maddox. Yes. Also, while taking antidysrhythmics, avoid alcohol, caffeine, and tobacco.
Welcome to the Magic School Bus headquarters. We hope you enjoyed our episode today. This is the time of the show where we take calls from our viewers to see what they think about the show.
Yeah, that was a great episode of Magic School Bus, but I have some important questions to ask.
Magic School Bus.
Well, hello there. My dad is a doctor, which, makes me kind of one of the smarter kids that probably watches your show, so I just had some real important questions. Whenever you talked about the different kinds of pharmacological drugs for different heart problems, you didn't really give a lot of information about antihypertensives or antidysrhythmics, and there's tons of those. Why is that?
That's a very good point. There are many types of antihypertensives and antidysrhythmics. Let me tell you what the different types are. We'll start off talking about antihypertensives. There's beta-adrenergic blockers, centrally acting alpha agonists, alpha-adrenergic blockers, adrenergic neuron blockers, alpha and beta-adrenergic blockers, direct-acting arteriolar vasodilators, ACE inhibitors, angiotensin II receptor blockers, direct renin inhibitors, and calcium channel blockers. Now we'll talk about antidysrhythmics. There are 4 classes of antidysrhythmics. We have our sodium channel blockers, beta blockers, class 3 drugs that can prolong depolarization, and calcium channel blockers.
Thanks so much. You're the best.
Well, thank you for your question. Another life changed.